Well, every day I'm faced with patients who are concerned about not only access, but actually being able to afford safe first world medical care.
The primary concerns I have are boiled down to safety for the patient on several levels.
I believe the most important components of doing procedures in a surgical center involve three critical areas. Number one, patient safety. Number two, patient experience. And number three, the importance of having quality programs that are built into surgical centers, formal programs which ensure efficacy and safety.
Additionally, one of the advantages of doing interventional pain in a surgery center, especially with our aging population, is we can address pre-procedurally a lot of the medical needs of the patients. We have patients that come in hypertension, or even come in unknown to any of us in arrhythmias, and when we place them on a cardiac monitor, we find these things. We have qualified staff to evaluate and deal with these kind of issues if they occur before or during or after a procedure.
Before we do interventional pain procedures in the surgical center setting, at least here at VVSC, patients are screened by highly trained nurses that are familiar with working in surgical cases and interventional pain cases. So before a patient even shows up to a surgical center, there's screening that occurs over the phone, and that can help us to identify red flags, potential concerns.
One of the challenges that I found when I was in my office doing procedures was that I couldn't maintain the proper staffing.
And a couple of important things to note here are the equipment which we use routinely and in the event of emergency. So we have a monitor which measures blood pressure and heart rate. We have also the ability to measure a patient's oxygen saturation level to make sure that's appropriate. And then along the wall you can see a number of instruments. We have needles very close to neural structures. We have needles very close to spinal cords. We have needles very close to delicate and sensitive tissues where if something does go wrong, patients can get sick very quickly. So having access to a full complement of support services as a practicing physician, I think is invaluable.
All of our procedures are done under fluoroscopic guidance. The fluoroscope, or it's a live x-ray machine, often called a C-arm, is a large piece of equipment which many physicians really can't have in their office for various reasons.
The importance of having fluoroscopic guidance is critical because these procedures can be done blindly. And in an office-based setting, obviously this is very sophisticated equipment and expensive equipment. If a particular physician can't afford or doesn't have the capability to access this equipment, I feel from a safety and from a quality perspective, we lose something there. In the unlikely event that a patient would have a complication, we have the ability to do pretty much anything that we would need to right here. The code or crash cart, which is the red box over here with everything we need to resuscitate a patient. Another nice thing about a surgical center is we always have immediate access to emergency personnel, anesthesia, a code team, a full complement of nursing and supplemental personnel, and certainly plenty of physicians to assist in the unlikely event that a patient would need services. All of those resources combined make this the safest place, the most effective place to do these types of high-risk procedures. And certainly if I were a patient, I would prefer to have my procedure done in this type of setting.
My colleagues and I are worried that rumblings coming out of Washington, D.C. appear to be proposing that these procedures be performed in office settings, which are both ineffective and dangerous. These procedures should be performed, and this money spent on the actual institutions and individuals that are providing this care.
And I moved to an ambulatory surgery center for very specific reasons. Mainly, I was seeing an aging population in my practice, and their medical needs were becoming much greater. And my ability to perform certain procedures in a safe manner, I felt was becoming compromised. And I was very happy to move over to a surgery center environment where we had all the appropriate monitoring equipment and the appropriate staffing, and then importantly also the appropriate equipment to perform these types of procedures in a safe way as well as an effective way.